Now, while the distress tolerance module was helpful and important for Jackie to learn, the emotion regulation skills were vital to Jackie managing and reducing her depression. The emotion regulation module in DBT is really devoted to helping patients learn how to reduce their sensitivity to emotions, as well as their vulnerability to stress. Sound like Jackie's second goal, right? When working together, we focused our attention on 3 principles from this module, those being stress management, increasing her feelings of competency, and increasing behavioral activation to help her manage depression and achieve her treatment goals. The emotion regulation skills benefited Jackie significantly in working towards her first treatment goal of managing safety concerns and suicidal ideation. First, we worked to build her resiliency to stress by increasing her engagement in a routine of getting effective sleep, exercising to move her body, and eating effectively. Because of her depression, as well as her efforts caring for her mother and just trying to balance work and school, Jackie was pulled in many directions and her self-care routine waned over time. She was provided psychoeducation then on sleep hygiene, and we spent time building a sleep hygiene routine for her. And this included things like making sure her TV was off at least an hour before bed, stopping all schoolwork by 10 p.m. every night, and spending at least 4 to 5 nights a week at her own home to be comfortable. I don't think she ever quite hit the point where she was able to spend 5 nights a week at her own home when we were working together, but she got pretty close a few times. These strategies allowed Jackie to relax her body and her mind and make sleep much more accessible to her in the evening. Over time, she began experiencing less night waking and actually started to get around her normal pre-depression levels of 6 to 7 hours a night and wake up feeling pretty rested and pretty good for herself. When it came to exercise, Jackie spoke with her primary care physician about what exercises she could do that would not inflame her pain even more, too. Engaging in activities like taking walks, stretching, or occasional swimming really helped Jackie to feel both like she was supporting her body, as well as feel like she was building a sense of achievement when completing an exercise too. This required her to pair her practice of non-judgmental stance, though, and not compare her current self with her past marathon running self as well. And it was tricky. Now, finally, eating regularly was an important behavioral change for Jackie as well. Like I mentioned earlier, she shared that she was eating a lot of junk food, going through the drive-thru a lot because it was what was accessible and easy for her as she was caring for her mother. She also shared that she would either forget to eat because she was busy attending to her stressors, or she would just feel uninterested in food, only leading her to feel more of what she would call hangry or hungry-angry. And when hangry, Jackie would then feel more stress, and she noticed her stress and distressing emotions would push her to engage in more avoidance behaviors, like ignoring schoolwork or ignoring interpersonal communication, like texting other friends, or she would even, I think on a few occasions, reported lashing out at other people around her because she was feeling that stress and that hanger. Also helpful to Jackie in managing suicidal ideation was her use of the build mastery skill too, where she would engage in activities that she knew would build what I called the 5 C's: competency, capability, confidence, creativity, and control. Now together, we built a list of behaviors that she could do that would help her feel more agency and empowerment, as well as reduce worthlessness and provide behavioral evidence to counter her negative self-judgments related to being stupid or inept. These types of activities included things like brushing her teeth, paying her bills, doing her laundry, painting, and completing projects at school or work. Well, she also was trying to be mindful and aware of any potential ineffective judgments that might arise from overachieving in those areas too. Another interestingly helpful thing for Jackie in feeling those 5 C's was cooking for herself too. Now, when we were talking about the build mastery skill, Jackie eventually came to call this skill the adulting skill because it allowed her to feel like a responsible individual who was capable of caring for themselves. Thankfully, Jackie's suicidal ideation never created emotions such as despair or anguish. But had they, I think the opposite action to emotion skill would have been an important one to impart on her here as well. To revisit her second treatment plan goal, Jackie was interested in building her stress management and self-care regimen to help her reduce depression as well. As we mentioned when discussing her first goal a moment ago, Jackie worked hard to implement her skills of sleep hygiene, adapted exercise, and effective eating to help her minimize her vulnerability to stress, as well as her reactivity to her emotions. We found it important to make the O2E, opposite action to emotion, and the BPE, building positive experiences. We found it important to make those two skills an integral part of her repertoire too. During one session, Jackie and I built a pleasurable activities list full of behaviors that sparked enjoyment, calm, excitement, fun, or even just neutrality. Now, because of the high degree of stress in her life, Jackie indicated when we first met that it had been a pretty long time since she had felt any type of enjoyment or amusement out of her life. So we started small with taking a few moments each day where she would make her favorite flavor of coffee in the morning. This was really important for her. That starting small was really important for her, as jumping right into something big like planning a big vacation seems pretty impossible for her given the level of her depression. This also helped her break up the stress in multiple locations in her life, like at work and school and at her mother's in particular. It also helped her to reduce the intensity of her depression, increase her behavioral activation, and just in general helped her to feel more excited about future events too. In those moments when Jackie would have emotions of apathy or low motivation to engage in skill use, she was taught to activate the O2E skill then. So that's, again, opposite action to emotion. So she would often utilize her mindfulness skills to first notice the judgments that led to apathy and low motivation, note the emotion, and then find a behavior to engage in that was opposite to her lethargy or indifference. Oftentimes, making herself paint for 2 minutes was enough to get her up and moving and induce a little bit of positivity to help her then build positive emotions or tackle other difficult tasks that she needed to do. Similar to her first goal, in which utilizing the build mastery skill was important to inducing a sense of competency and capability, this same skill was beneficial to her in working towards her third goal of managing negative self-judgments too. By actively engaging in those behaviors that contributed to feelings of empowerment, Jackie was able to refute her negative self-judgments and build self-respect. Similarly, when her negative self-judgments produced emotions like worthlessness, futility, or insignificance, engaging in behaviors that acted opposite to those emotions was really helpful for her. For example, I remember one time when she was feeling incapable of completing a school assignment because her judgments were telling her she was just incompetent. Rather than avoiding her schoolwork and failing the assignment, Jackie took to actually cleaning her entire kitchen top to bottom, feeling wonderful about her newly organized kitchen and also mindful of some of the black and white thinking that she approached that situation with. She was able, after cleaning, to sit down and write her entire paper in one sitting. I actually remember this because she ended up getting a B+ on her assignment, which she obviously was not pleased with, as you can imagine. Now, Jackie's fourth goal of improving interpersonal communication was not directly linked to her use of skills from the emotion regulation module, but she did find the use of one particular emotion reg skill helpful to her in reaching this goal. Over time, Jackie learned to use the opposite action to emotion skill when working to establish boundaries, practice her assertiveness, and foster relationships. Jackie would grow fearful of setting boundaries with her mother and fearful of asserting herself with her partner. So this skill helped her to recognize her fears, accept them, and then act in a way that reflected confidence and poise in her values and her relationships. Additionally, her use of O2E helped her to push away various emotions like depression, apathy, low motivation, and urges to isolate, to help her make efforts to build friendships with colleagues at both work and at school too.